All right, good day, everybody. This is the introduction to PODs, or points of dispensing and vaccination for the Medical Reserve Corps. Thank you for being here today. My name is David Calkins, and I will be your host for this training. Here is what we're going to discuss today. PODs, this is one of my favorite public health preparedness activities and one of my favorite things to talk about. So I hope that after this training is complete, you will walk away with an appreciation of what PODs are, why they are used, when they are used, how they can be used to meet any public health emergency preparedness hazards or any emergencies or disasters that might occur. And I hope that you'll walk away with some knowledge that will help you if you are deployed to a pod. So I'll provide some background on why pods are needed, how they were developed, and which programs fund them, and the kinds of things that sort of direct and encourage pod activities. And we'll talk about when pods are needed. So I have some specific examples. It's not always during just a public health emergency. Pods can be used in different types of emergencies. We'll talk about the importance of volunteers and how important it is that you support the human power effort that is needed in order to manage and operate pods on a large scale or on a small scale, depending on the nature of the emergency. And we'll go into the details of what happens at a pod. So things like screening and triage, dispensing, and medical consultation, those kinds of things that happen at a pod. We'll talk about those. And then we'll talk about the importance of the Incident Command System, or ICS. And I know as a volunteer, you're required to complete certain ICS courses. So hopefully that won't be new terminology for you. But if it is, it'll at least be a good review of the basics of the Incident Command System. And then we'll talk briefly about the after action process and how that helps us to improve pod operations throughout the duration of an event. So here's some background. So pods, or points of dispensing and vaccination, are really important tools for responding to public health emergencies. And the first example that's going to come to mind is obviously COVID, right? So we've done a number of pod operations for COVID, including vaccinations, but also testing. So early in the days of the pandemic, we used pod concepts and pod operations to operate testing centers throughout the community. And pods really require collaboration among what's called the whole community. So that means not only public health and public safety and government partners, but also the private sector and nonprofit organizations and faith-based groups. Churches were a huge part of our ability to reach members of the community, and that includes mosques as well. So faith-based groups were really important to pod operations because they can provide physical infrastructure, they can provide volunteers, and they can reach members of the community that public health may not be able to reach on its own. And then, as I mentioned before, pods can be used to respond to a variety of different emergencies, and we'll take a look at those. So just a little bit of background on how pods are funded. They're capability driven, which means that there are certain capabilities that the federal government directs local and state public health agencies to be able to do. So I'll talk a little bit about those, but there are two main cooperative agreements, which are kind of like grants, but it basically means that federal funding is provided and the federal government is a partner in completing those capabilities. So there are two, there's Public Health Emergency Preparedness, or FEP, and then there's a Hospital Preparedness Program. So the FEP cooperative agreement is driven by 15 capabilities, which were determined by CDC. And I'm not going to go through all of those, but a number of them are critically important for pod operations. And public health agencies are accountable to the federal government through the Operational Readiness Review and Project Public Health Ready. And those are programs that are designed to have benchmarks for state and local public health agencies to meet. And so each year, the emergency coordinator in your local health district has to complete the Operational Readiness Review, and every 5 years completes Project Public Health Ready. And in doing so, they have to document that they've met these capabilities. And we'll go through some of that documentation, but a lot of the activities that we complete for pods are able to meet those objectives and those benchmarks. So pods are used for all hazards, and what that means is that they might be used for a pandemic like we see with COVID, but they also might be used for an epidemiological investigation, an outbreak. They might be used to dispense water or other items to the public at large points of dispensing. and they might be used, in case of an acute emergency like an anthrax attack. And pod planning and funding really got a jump start after 9/11 with when there was a strong focus on bioterrorism. So you probably remember the anthrax letters that came out shortly after 9/11. And bioterrorism really was on the forefront of the minds of policymakers even prior to 9/11. Back in the 90s, when we had the sarin gas attacks in Tokyo, there were a number of terrorist attacks happening. And really, it was in the public consciousness of outbreaks, right? So you had the movie Outbreak, and you had Hot Zone, a popular book, and so there was a lot of talk about bioterrorism even prior to 9/11. Now, the hospital preparedness program, which is the other side of that coin, doesn't focus on pod planning or really public health, but I just want to mention it here because it is important. And it supports surge capacity in our hospitals, and it also supports emergency preparedness among healthcare partners, like not only acute care hospitals, but like long-term care facilities, dialysis centers, home health agencies, home hospice agencies, and other healthcare organizations that might support medically vulnerable populations. And just to let you know, what I'm working on right now, where I work right now is the Central Virginia Healthcare Coalition, and you can see them pictured here. But I'm currently the RHCC manager for the Healthcare Coalition, but I spent 6 years in public health doing pod activities, and really, and as I mentioned before, I just love pods. So I'm hopeful that my experience on both sides of this coin will be beneficial to you for your training. So as I mentioned before, the PhEP Cooperative Agreement has 15 core capabilities that were determined by CDC, and a number of them apply directly to the operation of points of dispensing and vaccination, or PODs. So I've listed a few of them here, and I'll just kind of briefly explain each one. So the first is community preparedness, and that goes back to that concept of whole community. So with public health being the lead agency for health emergencies, it really involves the whole community. So you have to bring together public safety, and that includes police and fire. Police provide security and traffic control at our points of dispensing. Fire might provide EMS support. Our sheriff's departments provide internal security. So inside the pod, we have people there to protect us. But also, as I mentioned before, faith-based groups, nonprofits, the private sector, we partnered with so many different entities during COVID response that it really was a whole community effort. And the next is number 3, which is emergency operations coordination, and that has to do with the incident command system, how we set up our organizational structure, how we document the events, and that sort of thing. And then there's public information and warning. And that's a big one because we have to let the public know when and where we're going to be holding these pods, so that they can make plans to come. And we also have to provide them with information that they might need beforehand. So for COVID, there was a lot of that kind of information about maintaining social distancing and that sort of thing. And then number 8 is the big one. That's medical countermeasure dispensing and administration. And that there are a number of tasks that you have to complete to meet this capability. And there are things like managing throughput, documenting throughput, all the 3 stages of screening, triage, dispensing, and that sort of thing. And we'll get into the details of that. Then responder health and safety. So that's number 14. That's actually should be much higher on the list, maybe even number 1, because we want to make sure that we maintain the safety of our pod workers, and that includes volunteers, not just public health personnel. And then the last one is volunteer management. So that has to do with notifying the MRC that we have a need for volunteers, and then your MRC coordinators put out alerts using VVHS that say, this is what is going on, please respond if you're available. And then if you're available, making sure you have all the information you need before you arrive. So we'll talk a little bit about that kind of documentation, and then providing support for you afterwards so you can be a part of the after action process, and hopefully you'll want to volunteer with us again. So, all right, here. So each PhEP capability has certain functions, tasks that you have to meet, and that's what the emergency coordinator, the local health district, is making sure that they and that their public health partners and coworkers can meet. So I've mentioned a few of these already, but identifying pod locations is a big one as well that I didn't cover. So when are pods needed? All right, I've already mentioned this a couple of times, but they can be used in a variety of emergencies, and I've prepared a few slides that give examples of that. And the first one, which is kind of not something you would think of as necessarily as a public health emergency, but water distribution in September in Jackson, Mississippi. And so after there was flooding at the Pearl River due to severe storms in the state, the water treatment plants were heavily impacted. So their water pressure was insufficient to meet health and safety standards. So this was a public health emergency, but it was brought upon by severe storms like heavy torrential rainfall and that sort of thing. So the governor declared a state of emergency for the city of Jackson on August 30th, and then the president declared an emergency, and that activated the Stafford Act, which greenlit federal aid to come in, and it really just streamlines the aid from the federal government to the state. And then the National Guard distributed water and hand sanitizer using pods. So you can see this image here showing the delivery of a crate of water. And so the National Guard was able to set up a pod to dispense water. And in some cases, we set up a pod to do vaccinations or provide medical countermeasures like post-exposure prophylaxis. But we can do things like water. And so it doesn't have to be limited to medical countermeasures. So one of my favorite events that I did during my time at Henrico Health Department was the Zika Fight the Bite pod. So back in 2016 and 2017, when Zika was at the forefront of our preparedness efforts, we wanted to reach the public and provide things like mosquito repellent, condoms, educational material, all to prevent the spread of Zika. So we went to one of our middle schools and set up a pod on a weekend, and we were prepared to receive 800 members of the public. So we would hand out a bag with mosquito repellent and all of the things I mentioned, and we used the pod format. So we would have people come in, they would be greeted, they would be sort of not really triaged, but then they would be directed through the pod the same way they would if they were receiving medical countermeasures. So this served as an opportunity for us to practice pod operations, even though we weren't providing medical countermeasures. We've also done a pod for a hepatitis A outbreak at a local chain restaurant. So it was a popular chain restaurant, and there was a hepatitis A outbreak there. And so one of the staff members was sort of the patient zero, if you will. And no customers were exposed, but that person's coworkers were. And so we set up a small pod where they could receive post-exposure prophylaxis. And I think in that case, it was just the Hep A vaccine, but I'm not sure about that. But they did receive a shot. And so they came to the health department, and it was a small pod, but a pod nonetheless. And then we do annual flu vaccinations. And of course, I'll just take a moment here to encourage you to get your flu shot if you haven't done so already, because of the nature of the flu activity and other respiratory illnesses that we're seeing in the region right now and across the state, across the country. So flu vax pods were, we did a number of these in the community. The picture that you see here was at St. Luke Apartments when it was known, this was 2017, so it was known as Essex Village then. But we were able to do a door-to-door vaccination campaign, and we had our public safety partners there to participate as well. But we do all kinds of flu vax pods. They can be large pods where the public comes to the location and receives the vaccination. We time the throughput, and generally we would see, if I'm remembering correctly, we would see between like something as short as 3 minutes all the way up to 15 minutes for a patient to get through the pod. And that's because people have different needs and might have questions and that sort of thing. But we were able to time how long it took everyone to get through the pod and then work to try to reduce that time. So we've been working with MRC volunteers since the beginning on this, and MRC volunteers are a huge, huge part of this. I mean, providing the human power that we need to move a large group of people through our pods as quickly as possible. So this shows, I think this might have been the same year, maybe the year after, but we did a door-to-door vaccination campaign at St. Luke Apartments as well. And this was a great way to reach members of the community that otherwise we might not be able to reach. And so here we have two of our MRC volunteers with our community health worker, and they went door to door, and you can see they're holding a chair, they're holding a cooler, and other supplies. And so they would knock on the door, ask if the person had received the flu shot. If they hadn't and they wanted to, they could receive it right there on the spot. So they would just set up right outside their door. They could sit in the chair. Our MRC volunteers there were nurses, so they could answer any questions the patient might have had. And then that was just a sort of an experimental modality that we wanted to try out. And we wanted to use this with COVID, but unfortunately, we were directed to not use a door-to-door modality for vaccinations, and that was due in large part to hostility towards the vaccine from a number of members of the public. So you can also use pods for anthrax post-exposure prophylaxis. And this was one of the main drivers of that bioterrorism funding that I mentioned before, and one of the main capabilities that your local health department needs to be prepared for. So in the event of a deliberate release of anthrax, and you might remember the anthrax letters from 2001, but in the event of a deliberate release, public health agencies can very quickly dispense medical countermeasures, including the two that we have are ciprofloxacin or Cipro and doxycycline or Doxy. And so we have those on hand at, I won't say an undisclosed location, but we do have a supply that we can quickly reach if we needed to set up pods quickly. So the pods in this case will be streamlined and fast-paced, and the focus won't be on getting patient medical history like it would for vaccination. It would be something like, how many people do you have in your household? Is anybody pregnant? Are there any allergic reactions to these two medicines? And then you just hand out the appropriate medication. So it's very, very quick. Sorry. So also for radiological incidents, and since we have the North Anna power plant and the Surrey power plant in Virginia, this is something that we do need to prepare for. So post-exposure prophylaxis for a radiological incident includes potassium iodine. And so if there were a radiological release of some kind and we needed to dispense KI, we would do so using the pod modality. And that would happen, interestingly enough, that would happen with a lot of other things going on, a lot of other emergency operations, including emergency sheltering, mass feeding, family assistance, and reunification, and evacuation. So a lot would be going on at the same time that we would need to be setting up these pods. So a lot of opportunities there for us. And then in the beginning parts of COVID, as I mentioned before, we used pod modalities to set up testing. And so we did a lot of outdoor testing because, the nature of the virus, we wanted to make sure that we reduce the risk of spreading the virus. So a lot of it was outside. But the stations included greeting, screening, registration, the actual testing, and traffic control, and then also PPE donning and doffing. So you can see in this picture here, the COVID testers are decked out in full PPE for gathering COVID samples. And then we would also have specimen packing and specimen delivery stations as well. And then that brings us to the big one, which is COVID-19 vaccinations. And your local health districts and all around the state conducted hundreds of these pods. And these really, despite all the practice that we had with flu vaccinations and the other pods that we've done, COVID presented novel challenges for us. And that included the availability of the vaccine. I mean, that was the first thing that we had to do, was we had to secure the vaccine, and we had to maintain temperature control. And so at first, the temperature control was lower than it is normally for the normal vaccines that public health dispenses. So we had to get a new freezer. And in just a quick story about that is we had to have that freezer delivered from, I believe, from China. And on its way here, it was on a ship that tipped over, and the packing container fell into the ocean, was lost. And I remember hearing about this in a meeting and somebody saying that is the most 2020 thing that could possibly happen. And it was just very, very bizarre. But eventually we did get a freezer. It was so big that we had to take down a door in our building in order for it to fit. But once we had it, that's where we stored our vaccines, and then we were able to deliver them to our pod locations. But we also had to monitor for adverse reactions. With it being a novel virus and a new vaccine, we established a monitoring area. And we generally did that before, but there was much more emphasis put on it for COVID. So we had 10 to 15 minutes or even longer monitoring periods. And then we had to manage the dual dose requirements for the Moderna and Pfizer vaccines. meaning we had to set up a registration system. We had to know if a person had already received the first vaccine or if they hadn't. So those are just a number of challenges that really expanded the scope of our pods. So as I mentioned before, it required the cooperation of the entire community. So we had public safety involved. Obviously, police would provide external security and traffic control. We had our sheriff's deputies providing internal security control, which was important because there was a lot of uncertainty among both us as public health and the public. And so we had to make sure that, we had security inside, just to make sure that nobody came in with any hostile intent, and that sort of thing. But also the private sector was a big one too. We partnered with different businesses to use their space, and they donated their time and their space. And same with other nonprofit organizations in the faith-based communities. Sorry, I keep flipping through these slides a little too fast. But I wanted to provide a couple of diagrams that showed what the pods look like both outside and inside. And so this one you can see is labeled showing where the entrance is, where the public and patients will be parking, where staff and volunteers will be parking, and that sort of thing. And this is provided, this should be provided to you before you go to a pod. So whoever is the planning section chief should provide this information to your MRC coordinator, and they should provide it to you so you have all the information you need prior to arriving. This shows the indoor setting, and this kind of shows an interesting diagram and layout. So this this was the East Rec Center in Henrico County, and you can see that there's a piano right in the middle of the area here. And so we often had to work around different things, and we had to work within the space that we could. And so places like churches and mosques might have smaller confined areas before you get to a congregate area. We just had to be creative in terms of diagramming patient throughput. And of course, we had to maintain social distancing throughout the entire operation. And again, this is something that should be provided to you as a volunteer prior to deploying to the pod. And this shows the actual vaccination area. So you can see there's a large monitoring area where we place chairs 6 feet apart. You can see the vaccination stations, and the arrows indicate the throughput for the patient. We'll go into a little bit more detail on actual pod operations in just a minute. So monkeypox and beyond. So anytime there's an emerging infectious disease, we can conceivably conduct pod operations if we need to. That could be to provide vaccinations, for example. In the case of monkeypox, the health department provided vaccinations to at-risk populations. So I just want to take a moment to discuss the importance of volunteers and to say thank you. I'm sure a number of you have participated in pod activities over the past couple of years. You really are truly the backbone of pod operations because the human power required is so large and significant that public health agencies can't do it on their own. Public safety agencies can't either. And so we rely on volunteers to staff our pods. And that often means that they're staffed after hours or on weekends, which are times when hopefully you can offer your time. And that impacts the ability of public health personnel to be able to staff these pods because they might have already worked a 40-hour week, probably longer, and they may not be available on weekends or evenings. And so that's one of the reasons we rely so heavily on volunteers. And so you can see here that during COVID response, more than 673 hours and a monetary value of more than 20 million over the course of the pandemic, and probably more by now. But that's what you provide for us. And oftentimes, like seeing volunteers and interacting with them, it really lifts the spirits of public health personnel. So I just want to take a minute to say thank you for that. Okay, now we're going to talk about the nuts and bolts of pod operations. So a pod site, if you want the real official definition given here, it's where medical countermeasures are given to members of the public to minimize the effects of a public health threat or emergency. So it could be pre-exposure, so in the case of vaccine, or it could be post-exposure in the case of anthrax. So it's typically in a non-traditional setting, so you're not going to see it set up in a hospital or a doctor's office or something like that. It's usually in a school because those offer, good parking and an auditorium or gym where you can have a large number of people move through. So as I mentioned before, it's not, it could be pre-exposure or post-exposure, but it's generally not a place where sick people go for getting medical care. So I mentioned before, it's not set up like a typical doctor's office, and it's not staffed strictly by medical professionals. We will have a doctor or a nurse practitioner on hand as the clinician, but for the most part, we will have our nurses there, usually providing vaccination or dispensing medications. But for the most part, it's staffed by administrative personnel. Excuse me. And while we do provide some level of medical consultation, of course, so through the screening process, we want to find out if the patient has any allergies, or if they're pregnant, or if they have a significant medical history that may impact their ability to receive the countermeasure. We will provide that level of consultation, but not beyond that. So activation and orientation. So when we know we need to set up a pod, and generally speaking, we're going to have some advance notice, because it's going to be, just like we saw with COVID, it's going to take us some time to get the vaccines or some time to get the testing kits. And we'll use that time to start notifying our volunteers of the need for pod operations. So you'll receive a notification that's usually going to come from your MRC coordinator through VVHS with all the details of the event. And then once you agree to attend or to participate, then you'll receive instructions on where to arrive. And so you check in at the check-in and sign-in table. And I can't overstress how important it is to sign in and out when you arrive at a pod. You'll receive just-in-time training after you sign in. You'll receive an incident briefing, and then you'll meet with your supervisor to get your work assignment. You can ask any questions that you might have. And again, you need to make sure that you check out and sign out. And the reason for that is we need to maintain accountability for everybody in the pod, not just if there's an emergency like a tornado, which did happen during COVID. We did have to take shelter at one of our pods when we received a tornado warning in the area. But we also need to make sure that you haven't, gone somewhere and like passed out, and you're somewhere like in the bathroom or something, and everybody leaves thinking that you that you had already signed out. Then that could be a huge problem. So we want to make sure that you sign in and sign out. All right, so the notification of the pod staff, it's going to occur, let's say with an anthrax scenario where we have to set up a pod very, very quickly. It might occur when supplies are en route to the pod. And the public health personnel that you'll be working with are contacted through the Health Alert Network. And then, as I mentioned before, volunteers are contacted through VVHS. So check-in procedures. Make sure you sign in upon arriving, and you might have to complete some forms if you haven't done so already. If you haven't already received your badge, you might be able to do so there. And then you'll confirm your work assignment. And at the same time, you'll be able to receive medical countermeasures for yourself if it's, a Cipro and Doxy kind of situation. But during COVID, we were offering vaccinations to our volunteers that were working at our clinics. And that's, again, remember I talked about responder health and safety, right? So we want to make sure that you get the medical countermeasures that you need in order to continue to help us and to stay safe and healthy. So training of pod staff, generally speaking, at the pod, you're going to receive an incident briefing where the planning section chief or the pod manager is going to walk you through the different stages of the pod. And then you're going to get some one-on-one time with your supervisor. You'll have a chance to ask questions and that sort of thing. And then you'll be oriented to the site, so you'll know where the restrooms are, what the plan is for lunch or food, where you can eat, and where all the equipment and supplies are that you might need. We'll provide, in some cases, we'll provide job action sheets. We do have those ready for a number of different scenarios, but if it's a novel scenario, then that may not be the case. And then you'll also get a clear, and this will come out in the incident action plan too, but you'll also get a clear organizational structure, who you report to, who reports to you, and any other communication requirements. So you might have a radio, for example, and you'll get some just-in-time training on how to use that. So checkout procedures. Once the pod operations are complete, we'll go to logistics. Will usually be breaking down, and different teams will have different assignments, but you'll be part of a debriefing or a hot wash where we can talk about what went well and what didn't go well and what we need to improve for next time. We'll need to restock all of our workstations and do any just-in-time training for the next shift as needed. And again, it's highlighted in bold in red here. Please be sure to sign out. All right, and next we'll go to the site functions and roles. So there are three basic parts of a pod, and you can modify these as needed depending on the nature of the emergency. But the three stages are greeting and triage, screening, and dispensing. So for greeting and triage, the basics that you need to cover are greeting individuals as they enter the pod. And here is where customer service is really important, especially for something like COVID, where there's, I mentioned before, some uncertainty. People are nervous. People are just a little on edge because of everything that was going on at that time. So making sure that we were polite and we were good representatives of public health, and assisting them with anything they needed. And that might be mobility issues, it might be a language barrier and that kind of thing. And generally, your local public health department will have plans in place for language barriers and that sort of thing. And you should have wheelchairs and other items needed for mobility access. And that's where you'll assist the client in completing their screening forms and then send them to the next station. And we'll go over these in detail. I have a few videos that we'll watch where you can see see these things happening and get a better idea of what it entails. So then for screening, that's where you're going to determine which MCM, if any, is to be given. And that's, as I mentioned before, you're going to go over the screening questionnaire might have allergies, whether or not the patient is pregnant, and that sort of thing, or a brief medical history. Like, for example, if they've had Guillain-Barré syndrome in the past, then that might prohibit them from receiving a certain type of vaccine. And then from there, you'll direct the clients to the dispensing area. And in dispensing, that's where the individual is going to receive either a vaccination or post-exposure prophylaxis or that kind of thing. And that the nurse who's there is generally going to review the questionnaire and talk to the patient and make sure they understand what it is they're going to be receiving. All right, let me take a break here. I'm going to stop sharing my slides and I'm going to share a couple of videos to watch. I'm sorry, this is just going to take me 1 second to get this ready for you.
If a threat agent is released and affects a certain population, the governor of the affected state can request Strategic National Stockpile, or SS assets, to supplement local resources. Federal assets will be deployed and delivered to the state receiving, staging, and storing site, or RSS site. The state will then distribute S&S assets to an individual point of dispensing, which is often referred to as a pod. Soon it will be time to start a medical countermeasure or MCM dispensing campaign for the affected population. Communications developed by emergency planners will be disseminated to the public through the media to provide specific instructions on what to do and where to go during this public health emergency. As a trained pod worker, you'll be contacted with more information on when and how you can assist the response effort. This will include information on how you and your family will receive the initial MCMs. Should you agree to work in a pod, you will receive some just-in-time training specific to the role in which you'll be serving. So you have an understanding of how a pod operates, let's go through a general overview of the main functions of a pod. As a greeter, You'll be stationed near the entrance of the pod and will be responsible for recognizing and sorting people to different areas in the pod. For example, if a man entering the pod shows symptoms of plague, you should direct him to medical care right away. Another example would be directing an individual with a physical disability to the appropriate line to address that need. In this role, you'll have the opportunity to provide information to the public and answer any client questions. You'll distribute screening forms and direct people through the pod. Next, clients will bring their completed form to the screening station. As a screener, you're responsible for reviewing the information filled out on the form. You should then use your state's screening algorithm to determine the MCM that should be dispensed and mark the screening form accordingly. If you're able to determine the MCM and no further clarification is needed, send the client with his or her form to the dispensing station. If more information or clarification is needed, you would send the client to receive additional assistance at the next appropriate station. For example, a patient with a complex medical history may not be able to take any MCMs offered at the pod. You would send that client to a station that has pod staff who can provide additional support and guidance. As a dispenser, you'll be responsible for reviewing the client's screening form and dispensing the appropriate MCM. You should also provide any relevant fact sheets and ask if the client has any additional questions concerning the MCM that was administered. Once you verify the client has no other questions, direct individuals towards the exit to leave the pod. In addition to these tasks, you also may be asked to collect the client's screening forms and place them in a specified bin. Because pods vary from location to location, it is important to verify the operational procedures of the specific pod in which you are working. This video provides a basic operational model for functions within a pod.
Okay, great. So that was a good overview, and it covered some of the things that we've already talked about, but hopefully that provided the visuals, hopefully provided you a better understanding of pod operations. So next, what I'd like to do is I'd like to take a look at another video, and we'll just go through each of the main roles. And just pardon me while I get this set up. All right, here we go.
Greeting clients arriving at the pod can be one of the most rewarding and vital roles performed within a pod. The greeter's role requires you to identify and sort symptomatic individuals and those requiring extra assistance, communicate vital information to clients upon entering the pod, distribute forms, and assist with form completion. As a greeter, you'll be one of the first volunteers or staff members to welcome the public into the pod. In this role, you'll perform 4 main tasks. Task 1, identify symptomatic clients as they come through the pod entrance. If a client shows any signs of illness, the greeter should direct that person to undergo additional medical evaluation at either the pod or a facility outside of the pod. Identifying symptomatic clients early in the process prevents people who may be infected from moving through the pod and interacting with those who are not ill. Before your first shift begins, you should receive a briefing on symptoms specific to the threat agent in order to identify clients who are possibly ill. Task 2. Communicate information to clients by letting them know they are at the correct location to receive MCMs, providing an overview of what to expect during the process, providing incident or threat-specific information, and estimating the amount of time it will take to get through the pod. Greeters should be aware of public information messages and methods that can be used to reinforce critical information to clients. Clients may ask you questions, which is why it's important to be familiar with and refer to any available FAQ documents and fact sheets. The just-in-time training conducted before your first shift should identify specific strategies and resources for addressing a question you can't answer. Task 3. Greeters will be required to distribute screening forms to clients and potentially provide assistance in completing the form. Because you may be assisting clients with form completion, be sure you familiarize yourself with the questions and required information on the form. It's possible that clients may have filled out the form prior to coming to the pod. Some pods may even have a designated form station where clients may complete their forms. Task 4. Lastly, as individuals enter the pod, identify and direct clients who require extra assistance moving through the pod. This could include families with small children, those with physical or cognitive disabilities, non-English speakers, or elderly clients. It's important you direct clients requiring special assistance into the appropriate next line to properly address their needs. Doing this prevents bottlenecks in the express dispensing lanes and doesn't slow down the flow of the pod. It's also important to note that because a public health emergency can be a stressful situation, it's possible you might encounter difficult clients entering the pod. Should you encounter a difficult client, remain calm and alert a team leader, security, or behavioral health staff member to help you manage the situation. Remember that each pod operation is unique, which means that the specific duties of the greeting role vary. Before your first shift, the unique details of your pod and the greeter role will be explained during the just-in-time training. As a greeter and one of the first pod staff to interact with clients, this role is extremely important in supporting effective and efficient pod operations during a public health emergency.
Right, great. And she said it's one of the most rewarding positions that you can have is a greeting and triage position, because you really get to practice customer service and help people. But like she mentioned, and I said it too, you can have difficult clients. I tend to think of people come to a pod as patients, but the term is kind of interchangeable between client and patient. But you can have a difficult client, so you do have to practice those skills of de-escalation, like she mentioned. All right, and next up we have a video on, I think it's going to be on screening. Let me pull that up for you.
Once clients have been through the greeting triage station, they'll take their completed forms and move through the pod to the screening station. Screening is the next major function that occurs during pod operations. The screener role requires you to review clients' forms, use the screening algorithm to determine the appropriate MCM for each person listed on the form, and direct clients to the appropriate next station within the pod. As a screener, try to screen client forms efficiently to keep the flow moving. But remember, it's also important to maintain a high level of clinical accuracy. As a screener, you'll perform 3 main tasks. Task 1, review the client's form for completeness before determining the appropriate MCM. The form you review will likely be divided into 2 sections. The first section will be filled out by the client, which will require information such as name, contact information, children's weights, current medications, medication allergies, or existing medical conditions. The second section will be filled out by you, the screener, which will require noting the appropriate MCM for each person on the form. It's important to remember each state has its own screening form, which means it's likely you'll see a variation of required client information. Depending on the design of the pod, the responsibility of checking for accuracy may fall on either the screener or staff located elsewhere in the pod. Ideally, other staff check for this as clients move through the line before reaching the screening station. Task 2. Use the state's screening algorithm, which is a decision matrix that uses the client's responses on the screening form to determine the appropriate MCM for each person listed. Screeners verbally confirm any health conditions or factors that could affect the type of MCM received with the client. Those clients who are ineligible to receive an MCM at the pod may be required to go to a healthcare provider for further evaluation. If a client is eligible to receive an MCM, note on the form the type of MCM to be received and any other required annotations. Complex questions may need to be addressed by the screening team lead, supervisors, or other pod staff for further clarification and to prevent bottlenecks at the screening station. Task 3. Direct the clients to the dispensing area to receive MCMs and any relevant health information sheets. Depending on the MCM, screeners may direct clients to different dispensing stations within the pod instead of a single dispensing area. For example, some clients may have allergies to the primary MCM being dispensed or are taking a medication that could interact with the primary MCM. These clients may need to be directed to a dispensing station where they can receive an alternate MCM or discuss other options with the appropriate volunteer or staff member. Because clients may go to different stations, it's important you know the criteria for who goes to each station. Most pods are designed so that the client will go to the dispensing station next, but be sure to confirm the flow of your pod with leadership staff. Because pods are different, remember that the responsibilities of the screening role at your pod may be slightly different and will be covered during the just-in-time training.
Great. Okay. I really do hope that these visuals are helpful for you to see how pod operations generally do work. And I've got one more video for you that's going to cover dispensing.
Now that clients have been through the screening station, they'll take their screened forms and proceed to the dispensing station. Dispensing is the last major function that occurs during pod operations. Depending on state dispensing regulations, dispensers may be trained volunteers under the supervision of a medical professional, while others may be licensed medical personnel. Providing MCMs to the public is one of the main goals of a mass dispensing campaign. By dispensing medication, we can decrease the number of clients who become ill and ultimately save lives. To address a variety of client needs, pods should have multiple dispensing stations. Most pods have express dispensing stations for clients with uncomplicated medical histories who are able to take the primary MCM. In contrast, individuals with physical or cognitive disabilities, families with small children, non-English speakers, or elderly clients should be sorted into a dispensing line that addresses these clients' needs and may require additional time at the dispensing station. Whether you're working at an express dispensing station or a dispensing station designated to address a specific need, you will perform 4 main tasks when dispensing antibiotics. Task 1. Take the client's form and review the screener's notes to identify which MCM should be dispensed for each individual listed on the form. Task 2. Pull the correct MCM from the inventory stack, peel the label from the bottle, and apply it to the appropriate area on the form. This process is done for each individual listed on the form. Applying the label to the form assists pod staff in tracking client medication. Verify that the client knows the specific medication each person on the form is to receive. It's also important to note that the medication inventory should be easily accessible to you, but not to the public walking through the pod. If you see medication placement that could pose a potential security risk, immediately notify your supervisor. Also remember to keep an eye on your medication and supply inventory levels. If you notice your supplies starting to get low, notify staff members responsible for resupplying inventory. Task 3. Provide a bag with all of the client's medication and any relevant information handouts such as pill crushing instructions, medication fact sheets and adherence instructions, or websites that clients may use to obtain additional information. Depending on the requirements of your state, you may be asked to collect client forms at the dispensing station and place them in a specified bin. Verify the form collection procedure with your pod supervisor or manager. Task 4. Ask clients if they have any additional questions before leaving the dispensing station. In general, there will be a pod staff member at or near the exit reinforcing instructions or answering last-minute questions. However, it is best to address any questions before clients leave the dispensing station and proceed toward the exit. Should you come across a question you can't answer, direct them to your supervisor for further clarification. Now that you've dispensed the medication, provided health information sheets, and answered any questions, the client will proceed to the exit and leave the pod.
Okay, so he mentioned a couple of things that I just want to note. The first being the importance of security. And so there are basically two different kinds of pods. There is the medical pod, which is like a COVID vaccination pod where you're gathering health information for which HIPAA applies, and you're dealing with medical histories. And so there is, I mentioned before, that level of consultation that happens with the patient. And in that case, HIPAA applies, so you have to be very careful about protecting the registration forms. In some cases, for flu vaccinations, we keep those because it becomes a part of the patient's record. And then you also have to, in the case of COVID, you also have vaccine control and temperature control. And so we relied on our volunteers who have years of medical expertise to make sure that temperatures were maintained. So that, you'd have to check the vaccine fridge or the coolers, check the temperature and log it every hour at least to make sure that temperature control is maintained. So those kinds of things are really important. And depending on the nature of the pod, in this case, he said that once the medications are dispensed, the patient can exit the pod. Now that's true for a non-medical pod like Cipro or Doxy dispensing in the case of an anthrax attack. But it's not true for something like COVID, where we have to monitor for adverse effects. And so the patient's going to go sit in a monitoring area for a certain predetermined length of time before they can exit the pod. And I just wanted to make sure I mentioned that difference. Again, please just give me 1 second to start sharing the PowerPoint again. It's just taking a second here. Looks like it might have frozen up a bit. Okay. Sorry about this. Just please give me 1 second. And next up, now that we've completed the videos, the next part of the training will include incident command system and pods. All right, it's just taking another second to load. I apologize. It seemed the page became unresponsive after I did the videos, but we'll see if it works now. It's coming back up. Okay, here we go. All right, so back to our presentation. And now I want to talk about the incident command system. As I mentioned before, I know that volunteers are required to take a certain number of ICS courses. I believe it's 100, 700, and 800. And that should give you the knowledge that you need in order to operate at a pod. And I'll just go over a couple of things that are most important from ICS. And the image that you see here on the right side of the screen is the planning P. That's the planning process. And that involves a number of meetings before we even get to set up the pod. Volunteers generally aren't part of those. That's public safety and public health, as they're determining the objectives for the pods. But once you get to the pod, you're going to have the incident briefing, as I mentioned before. And that's where you'll receive, a walk through the pod, some explanations about where different things are and what to do in the event of an emergency. But two of the concepts that I'd like to talk about are unity of command, and you may remember that from your ICS classes, and that means that everyone has only one supervisor, and that really just helps avoid confusion. So when you arrive at a pod, you're only going to be reporting to one person, and then that person's going to be reporting up to someone else, on and on until you get to the pod manager. And then there's also span of control. So in the event that you are supervising other pod employees, well, not employees, but other pod operators, you should only have 3 to 7, with 5 being the optimal, but definitely no more than 7. And another really important part about ICS is documentation. And the reason that's important is because our local partners, let's say the city of Richmond, for example, will request reimbursement from FEMA for expenses incurred during an emergency. So for COVID, for example, they provided staff to provide EMS support, for example, at our pods. And so they have to pay their staff overtime because they're working longer hours. This is just an example. In some ways, it's even hypothetical, but the idea is that they need to be reimbursed for those costs. In the case of Richmond City, they also provided lunches for us. And that's really important because we need to be able to feed our pod staff. So they need to be reimbursed for that. And the way that that happens is that they submit reimbursement to FEMA. And in order to do that, they need to provide certain NIMS and ICS documentation. NIMS is the National Incident Management System. And that's required before FEMA can provide reimbursement. And part of that is a sign in and a sign out sheet. And so for each pod, we would have everybody sign in and out, and then we would document that sign in sheet and provide that to the city so they could submit it for reimbursement. And that's just one example of why it's really important to have the proper documentation. Because if they don't have that documentation and they don't get that reimbursement, then the city has to incur that cost. And what that means down the road is they might be less inclined to participate in our pods. So here is the organization chart for one of our pods, and you can see at the top you have a pod manager. And I just had to be determined in each of the sections here. This was really just like a diagram. But you can see here at the top you have the command staff, which is those gray boxes. And then you have on the bottom you have your general staff, which starting from the left with the blue, you have your planning section, and they're responsible for determining the pod site, coming up with the incident action plan diagrams that I showed you before, and making sure everybody has that information prior to the pod. And then in red, you have operations, and that's the boots on the ground. Those are the vaccinators, the registrars, the greeters and screeners, traffic control, and that sort of thing. And that's really where the bulk of our volunteers fit in. And then you have, to the right, yellow, you have logistics. And in one of the videos, they mentioned the person responsible for restocking medications. That would be logistics. They're also responsible for setting up tables and chairs and cones and that sort of thing. All right, so this picture here shows, I believe this was the very first pod we did in Richmond City, and it was a small one at the Richmond City Health District. But what this picture shows is the incident briefing that happens right before. So that's me. I was the plan section chief, and so I was going through how the pod was going to work, the throughput, the patient flow, how they're going to move through the clinic, and where everything was that everyone needed. And so, as I mentioned before, the planning section, you assess the site before you decide you can hold a pod there. You make a plan for the location of the stations. You draft up the incident action plan, provide the briefing. I mean, you can even do things like time patient throughput. So I would sort of sneak away and find a place where I could observe, and then I would time patients going through. So we can just figure out how can we improve and get that time reduced in the next pod. And then, as I mentioned before, the operations section, that's all the people standing around me. So those are the people that are actually doing the boots on the ground work. They're going to be, as I mentioned before, screening and triage, registration, dispensing and vaccinating, monitoring, and that sort of thing. And then logistics. So they handle the setup and takedown of the pods. And this picture here shows Arthur Ashe Center, where we held a number of pods. I mean, that was like our main site for the Richmond and Henrico Health Districts to hold our pods. And so you can see they set that up, and we were able to leave it set up for a few months at a time. But in some cases, the logistics section does have to break down and set up every day. Fortunately, they didn't have to do that in this case. And then you also have the finance and admin section, which wasn't on that organization chart, but it still exists. And they're the ones responsible for event documentation, so documenting the time that people worked and the FEMA reimbursement process. And then you have the after action process. And I would really just like to stress here that if you are attending a pod, the after action meeting or the hot wash should be included as part of the event timeline. And I'll just ask that you make an effort to schedule some availability to stay behind after we shut down pod operations for 10 to 15 minutes so we can get your opinion on how things went. Like if you're there doing the work, we really want to hear from you to see how we can do things better. And you bring, I'm sure, years of expertise, a lot of knowledge and experience, and that has been so beneficial throughout the entire COVID process in helping us improve our operations. All right, and that brings me to the end of the presentation. Here is my email address. Please feel free to reach out to me if you have any questions. I'll do my best to get back to you. If I don't know the answer, what I'll do is I'll reach out to someone who does and connect you with them so they can help you. And that's the end of the presentation. Thank you, everybody, for attending today's presentation. I hope it was beneficial. I hope that you got something out of it, especially a love and appreciation of pods like I have. Thank you all so much.